Hey there, this is Dr. Manish Shah. I'm a board certified plastic surgeon here in Denver, Colorado, and I'm also a member of the Rhinoplasty Society. So you come in to see me for a consultation and your concern is you don't like the hump on the top of your nose. Do you actually know what the hump is made out of? Well, look at this little graphic right here. The hump is actually made up of two different things. It's made up of the last part of the nasal bones and the first part of the septal cartilages. And so when we're doing hump reduction surgery, it means that we're going to be taking down a little bit of the bone and a little bit of the cartilage. Now, depending on whether your surgeon is using structural techniques or preservation techniques, how the hump gets reduced is going to be different. If they're using structural techniques, they're going to do an operation in which either they go through a closed approach or they make a small incision in the columella of the nasal skin and raise the nasal skin up. But then they come in and they either rasp down or use the piezotome, which is an ultrasonic device, to scrape down the nasal bones, and then they will sharply resect this part of the cartilage. Then your nose gets a little wider, and then we do very specific nasal bone fractures to re-narrow and close what they call an open roof deformity. If your surgeon is using preservation techniques, what they're going to be doing instead of getting rid of the top of the nose or taking the hump down is they're going to make cuts around the nasal bone, and they're going to remove sections of this cartilage called the septum, and then they're going to push the hump in or drop the hump in so that the hump disappears. In a preservation rhinoplasty, we don't do any destructive techniques on the top of the nose, unlike in structural rhinoplasty. So when you ask for a hump reduction, that's basically what's happening. So I hope this helped.